following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, Veterans Healthcare. 3 experts are here to answer your questions. Now here's your host, Dr. Raleigh Sullivan.
Good evening. We've been watching Citizen Again, which is the final installment of the Bridgeport to Baghdad series that explores what it's like for veterans to return home from war. West Virginia has more than 7,500 veterans of the wars in Afghanistan and Iraq, and they've been involved in situations never seen before. IED explosions, suicide bombings, in addition to all the usual horrors of war. How can we help them adjust to life back home? What are the special problems faced by rural veterans? What resources are available to help with traumatic brain injury and post-traumatic stress? We'll get answers to those questions and more tonight from our 3 guests, Dr. Jack Riggs, a WVU neurologist and captain in the Navy Reserves who spent a year caring for soldiers at the U.S. Military Hospital in Kuwait. Hilda Hetty, Associate Vice President for Rural Health at WVU, who serves on the National Rural Health Advisory Committee to the Veterans Administration, and Jeremy Harrison, a social worker for the Department of Veterans Affairs who specializes in the treatment of adjustment issues. If you'd like to ask our guests a question, give us a call. Our phone lines are open now. Or send us an email at doc@wvpubcast.org. So Jeremy, let's start with you. You served in Operation Iraqi Freedom. Your unit played a critical role in the fall of Baghdad. We're still sending soldiers there. What can you, what do you tell them? What do you recommend?
Well, this is a good question for me to start with because my brother actually just deployed to Baghdad about a month ago, and we had this same discussion. And you have to be careful because you want them to be focused when they're going. You don't want to prepare them for potential danger in a way that's going to scare them before they even go. But I encourage them to be vigilant. You have to be ready for anything to happen. There's the potential for really bad things to happen while they're over there, very dangerous situations, and they have to stay focused and be ready for anything. And if something does happen, make sure that you take care of yourself and the people that you're with.
Okay, well, that sounds like reasonable advice. Let me get Jack into this. Jack, I know that you were in Kuwait in 2005, and you're a neurologist by trade. You obviously saw a lot of head injuries.
Yes, we saw the whole gamut of head injuries, gunshot wounds, crush injuries, skull fractures, subdural hematomas, epidural bleeding in the brain, and then frequently from the improvised explosive devices, we saw a lot of post-concussive syndrome.
Mm-hmm. And what post-concussive, what does that mean?
Well, if you're exposed to a blast, and sometimes the pressure wave from these blasts is enough to cause significant traumatic brain injury, if you weren't injured directly with the shrapnel, frequently you'll have trouble with ringing in the ears, can't hear, headaches, can't think, like any concussion, and it would take takes a couple weeks to resolve. The units that were in Iraq would send them down to us, just for us to make sure that that we weren't missing any serious TBI, so that they could recuperate and return to duty. And while I was there, we returned all but one back to duty.
TBI being traumatic brain
injury. And these were post-concussive syndromes.
Mm-hmm. We may get back and talk some more because I know that has some long-term problems associated. But Hilda, I know that last week you testified before Congress, about the special problems associated with the rural returning vet.
Absolutely. We're seeing a tremendous amount of access to health care and mental health care issues with our veterans and returning soldiers into rural America. 85% of all of the shortages that we have in mental health professionals occur in rural America, and 75% of all the primary care physicians. Rural people are disproportionately represented among military, active duty military personnel and among veterans. And if you are a youth in a rural zip code, you've got a 44% greater chance of enlisting in the service compared to 19% if you have an urban zip code.
Wow, that's an interesting statistic.
Yes.
So we have 7,500 returning vets, and you're
Yes.
saying that
A large part of those folks are rural people, and they're returning to their rural communities, seeking services, and even if they get to the point where they want to reach out for professional mental health services, they may not be available in their community.
Well, let's talk a little bit about, any of you can if you want to, what kind of services are we seeing that people need when they come back from Iraq or Afghanistan?
They vary. Some people are coming back there are a lot of musculoskeletal issues. Just by the weight of the equipment that they have to wear when they're there. We're seeing a lot of back injuries, leg injuries, neck injuries, those sort of things. Statistically speaking, in terms of mental health conditions, we're seeing about 1 in 3 that are coming home with symptoms of what could potentially be post-traumatic stress disorder, or PTSD, as we call it. Depression is another big issue. And some of the things that the veterans are dealing with in particular are the sleep issues, anger issues, isolation, withdrawal, this sort of thing, relationship problems. So there's a wide array of things that are going on with our vets.
Well, we have our first email contact, so let me read it. It's from Kanawha County. They didn't want to give their name. That says, what is the best way to deal with someone who is in a post-traumatic stress disorder rage?
Well, it would be helpful if we knew if this was a spouse of a returning soldier or veteran. Of course, the first and foremost thing is that you need to make sure you are safe, others in the home are safe, and that if there's children involved, they are safe. But a rage can be defined in a lot of different ways. Sometimes people have a very quiet rage, and it's that unknown that may happen. But the other thing that's very important to know is that the vet centers, which are storefront operations, we have a large network of vet centers in West Virginia. You can walk in and just be seen or talk to anyone, and you do not have to have you don't have to be signed up for services or whatever. You can just walk in and they will help you out, talk through the situation and see what might be helpful for you. And then if you elect to, you can become part of support groups or educational groups to help you acquire the kinds of skills that you need to really connect with your own resilience, as well as help your returning soldier or your vet to reconnect with that resilience.
That makes sense.
Yeah, we have 7 vet centers in West Virginia with outstations in Logan County and Parkersburg as well.
With what kind? Outstations?
Outstations, yeah. Well, they're affiliated with one of those 7 main vet centers, but they have their own. It's like an outreach center in an area away from the main center. And most of those, most of the vet centers will have staff that go to another city, maybe 45 minutes away, up to maybe a couple hours away, and go there 1 day a week, just to provide services in those rural areas that we're talking about.
Now, the vet centers are outpatient centers, so they're open from typically
8 to 5.
8 to 5, and
with evening groups and appointments if needed.
And they'll be staffed with counselors and
therapists. Some of them have family therapists.
Yeah, one of the things, and maybe this is as good a time to talk about it as any, because we talked about all the vets who are in West Virginia who have come back, but we haven't talked much about the families and the spouses. Can you all do that for a little bit?
I'll be happy to. The thing what has happened when they're deployed is that many times the spouse that remains becomes both parents and takes on responsibilities that person had with other family members. It may include the parents of the person who is deployed. And sometimes when the soldier returns to that kind of environment, their role has already been taken over by somebody, and they have to make that shift. Children, we know that children get special kinds of issues come up when they have an absent parent, and they're, sometimes their grades are affected, sometimes there's all kinds of issues. Right now in the United States, we've got over 1 million children under the age of 11 who've had at least one parent deployed for at least one time period. And again, it's just important for families to remember that they have needs as well, and that if they feel that they want to talk to somebody, they need to reach out, they need to talk to even among the other spouses and other family members of deployed soldiers, and certainly they can reach out and get assistance through their clergy, through a local mental health center if they have one, and certainly through the vet centers again. I highly recommend them.
So this can occur, all the vet centers can help deal with the families?
Yes.
They all do? Well, then maybe it's interesting because we have another email from Kanawha County, and this one is from a 30-year-old man who wouldn't give his name either, who said he'd like to talk to somebody like Jeremy in Kanawha County.
Okay.
Well, he can do that.
He can do that. There is a vet center outstation located in Kanawha County. And look it up in the phone book, or you can go to the VA's website, va.gov, which has a link specifically for vet centers, and it'll provide the information, the contact information, and the location of the nearest vet center, and the outstations are on there as well. Call them up or stop in the office, and somebody will see you that day.
Well, let me ask, do the vet centers, are they staffed with vets like yourself? I mean, is that...
Some are. Our staff in Wheeling in particular, there are 4 of us, and we're all combat veterans. In some other centers, they're made up of veterans, combat veterans, and some are not, but a lot of them are.
On that website, if you go to va.gov, there's a bar that says Facility Locator. If you click on that, it brings up a map of the entire United States. You click on West Virginia, and then every one of the VA facilities in West Virginia will pop up, and all of the vet centers are listed with the contact information for the therapist that you can either call directly or email.
In West Virginia, we have 4 VA hospitals, is that correct?
Yes.
And we have 7 vet centers with outreach.
Yes.
Okay. How many people, do you have any idea how many servicemen and families we service in West Virginia?
How many we service?
Yeah, how many people use the service? I'm just curious.
I do know how many current PTSD diagnosed vets that we have that are either inpatient in one of our 4 VAMCs or being served through a vet center, and that's 2,151 as of the end of last year, December of last year. But one of the things that we also know about veterans is that the VA only serves about a third of them. In other words, only about a third of all veterans actually seek services through the VA, and so we have a tough challenge trying to get people to sign up for the services that they're eligible for. So I don't really know exactly how many we have for other kinds of conditions that may be here in our vet centers. At one time, the vet center in Morgantown had one of the highest numbers of contacts across the country.
I was wondering if it was really, my guess is it's a really busy service.
Right, it is.
Okay.
They had 26 operational groups in a week.
26 groups in a
Yes.
week?
26
Yes.
groups in a week.
Wow, that's impressive.
The vet
Wow.
centers really started as a way to try and serve the Vietnam-era vets who were just not going to the VA, and they wanted more anonymity. They wanted a storefront operation. They wanted to talk to other vets. They wanted to be able to have something that was more accessible. And so that's how the vet center program actually started, was for readjustment for the Vietnam veterans who had already been home for a long time.
I see. We have another email from Fayette County, Pennsylvania, a 37-year-old man who didn't want to leave his name. He says he was a refugee in the first Gulf War and would like to know where he can seek treatment.
He was a refugee.
He's a refugee.
He's not a veteran, but he was in a refugee camp.
Ooh.
Any help? But he's having a similar sort of PTSD
Well,
kinds of problems.
we do see that PTSD does affect, certainly the warrior, but it also affects those who love the warrior. And certainly anyone who's caught in combat and caught up in a war can be affected also. I would simply, for this individual, suggest that if he has any kind of connections with a clergy or a local church, that he might want to seek assistance there, because we do find that a lot of local clergy now, because we're at war, are being trained on how to assist victims of war.
Well, the other thing I was thinking was also if he wasn't a veteran, he would be eligible for general psychiatric
Sure.
care,
Yeah,
and certainly
any service.
PTSD can.
Right.
Well, there's a lot of psychiatric
Absolutely.
services available. Every county has that, and
Exactly.
I think maybe if he went to his county or went to his local physician, frankly,
Right.
and got a
Yeah.
referral, that would
Right.
probably be.
And if he hasn't
Yeah.
seen his own primary care physician and discussed these issues, he probably should bring them up at least with his physician.
Yeah.
Okay. We have another email, also from Kanawha County, and they're asking why are antidepressants and antipsychotic medications used as the main treatments for PTSD? How long should they be used, and are they safe?
Well, I'll start with the last part of that. They are safe. There are side effects with every medication you can take, but overall they're safe. These antidepressant medications that are given, there are physiological problems that happen as well for people who are suffering from post-traumatic stress disorder. Serotonin levels are low. We're dealing with memory issues. We're dealing with other chemicals and hormones in the body that change. One of the main category of these medications that are given for PTSD symptoms are the SSRIs, or selective serotonin reuptake inhibitors. And those essentially take the place of that serotonin that's lost that helps stabilize the mood while the person is going through their therapy. It's referred to sometimes as a bridge until they learn the techniques to be able to handle the situations they're dealing with themselves. But something is needed immediately in a lot of cases to help ease some of the anxiety or the stress or the depression or whatever is going on so they can manage it themselves and their families.
And it's also important to remember, because we've certainly learned this very recently, that PTSD also has physiologic symptoms, that there are certain kinds of things that the body reacts to and goes through, and sometimes having something that assists a person to sleep or can lower their anxiety level is very important for their body to then be able to help find that resilience and heal all over again. I think it's also important to realize too, though, that we know that individuals with PTSD will self-medicate, and many times we're talking about other prescription drugs, we're talking about alcohol, we're talking about other kinds of drugs, street drugs, and if an individual is on some of these medications, it's very important not to participate and to use those drugs, but unfortunately we find that some of these people are in so much pain and wanting to be healed so quickly and wanting the pain to go away that if the drugs don't work right away, they will begin to self-medicate. And so I just certainly warn them not to do that.
Yeah, I know that's an issue. You may have something to say about association of PTSD and alcohol, I'm not sure, or prescription drugs, but it seems like it's a fairly...
Yes, very common.
76% of combat veterans will abuse some sort of substance at some period of time. It's a
76.
significant number.
Let me get in a call. We have Dave from Mercer County. Dave, welcome to Doctors on Call. You have a question for the panel?
Yes, I just want veterans in general to mull over what can be done about the VA not offering health care or even offering inappropriate or wrong health care on purpose. Now, it's not my own dad, who's a pre-World War II vet. He doesn't seem to have any problems when he goes to the VA. I mean, he doesn't have anything serious, primary problems from his veteran experience. But myself, I noticed the Chicago office and a bunch of offices just throwing away applications for disability and stuff for veterans. And in my own case, I testified with the veterans on the ball in '71. I criticized U.S. foreign policy, and when I went to the VA for a back problem in the early '90s, I didn't go to Beckley. I went to Roanoke. I was X-rayed. I'm pretty sure now on purpose twice. From the top of my chest, they X-rayed my whole back for a back problem, and as a result of that, I have cancer today.
Dave, it sounds like you have concerns about the quality of VA health care, and you want to address that, anybody?
I mean,
take it, Jack?
sure. I mean, I think that the VA has become very open today, especially to the returning OEF and OIF veterans. I know that I get multiple mailings almost every month from the VA. The VA is very receptive. The VA website is the way to seek and get help. And I think for returning vets, it starts with your post-deployment health reassessment. You need to honestly fill it out. If you're having problems, you need to mention it there, and help will come, but you need to ask for it.
I wanted to add something to Dave's comment. It was just last year, the VA VA healthcare system overall was identified as the best healthcare system in the nation. And that was by the surveys that are given out by the VA medical centers, filled out by the veterans. Just like everything else, it's a work in progress. They have to identify what the needs are and they address them. Sure, there are some shortcomings, as there are in any facility in the nation. But the reality is that they're addressing those problems, and some of the things that he was talking about, he mentioned paperwork that was getting thrown away. Those people were being taken care of. Those people have been since removed from their positions, and he knows about that because it's been made nationwide, and it becomes a very big issue when something happens. So as a result of that, it's fixed. They fix it.
So at this point, as far as you're all concerned, the VA healthcare system is doing better, maybe pretty darn good.
I use the VA Medical Center myself, and it's phenomenal.
Really?
I think in West Virginia, we're very privileged to have a wonderful system within our VAMCs and all of their outreach clinics, and certainly the vet centers. And it is different. It is certainly different than it was with my experience going through with the Vietnam era veterans. It's a lot different kind of experience than it was then. And the national committee that I'm on is looking at ways to try and improve access for rural veterans across the country. And one of the things that we're looking at right now, in fact, I just completed a conference call on this subject yesterday, is that we're trying to figure out ways for the VA to contract with local providers and community health centers and mental health providers in rural areas so that the individual can still get their VA benefits but go to a physician in their local community or a mental health provider in their local community. And that would be done on a pilot basis in those areas where we do not have VA services.
I got you. Jack, I want to ask you something before. We only have 2 or 3 minutes left, and I want to ask you, I was really surprised by how many traumatic brain injuries occurred in Afghanistan and Iraq. What do you typically see over time? What do people experience? I know it's a hard question because some are really severe, but
some are severe, and a lot of times you have some cognitive dysfunction where you have difficulty processing information and thinking. It's a very broad question.
Is this something that's likely to linger for days or weeks or months? What do people, what do you typically recommend for this sort of thing? And I realize it's difficult.
It can linger permanently.
It can linger permanently.
If you have multiple injuries, multiple concussive injuries, as we were just discussing earlier. The one Marine that I did send back, this was his 3rd IED. He was a Newark, New Jersey homicide detective who said, "Doctor, I just can't process my thoughts anymore. How am I going to return to my civilian job as a homicide detective if I can't put 2 and 2 together?" And just like with the concussive injuries the studies that have gone on in football players, multiple injuries can be accumulative and then produce permanent disability with your ability to think and process clearly.
Let me say, last 30 seconds, what do you recommend for people that need help? What do you want them to hear out there?
Ask for help. Go to the VA, ask for help. Say, "I need help."
I need help.
The vet centers are everywhere, the medical centers are out there. You can walk in and they'll see you that day. If you need some help, ask for it, it's there.
And even if you just feel like you need help and you don't know exactly what it is, they'll help you figure it out.
That's great. Very good. Well, we've been talking about veterans' health with Dr. Jack Riggs, Hilda Hetty, and Jeremy Harrison. Thank you all for being with us. If you'd like more information, go to wvpubcast.org or visit our website at wvuhealth.com. For Doctors on Call, I'm Dr. Raleigh Sullivan. Good night and good health.
Join us again next week for an encore presentation of Doctors on Call. The topic will be the science of sports. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.